Welcome to our wonderful facilitators for our Ethics and Humanities small group sessions. We're so glad you're here. Some of you might have been with us before. Maybe you'll hear something new during this session. And to those of you that are new, that haven't been with us before for our Ethics and Humanities, welcome. We are so glad to have you here. Now, we want to start with a quote that we do share with our first and second year medical students. This is by the Reverend Peter Hans Kolvenbach, who was a Jesuit priest and professor. He died in 2016. One of the things he said was students in the course of their formation must let the gritty reality of this world into their lives so they can learn to feel it, think about it critically, respond to its suffering, and engage it constructively. These are the things we want for our students. We want them to have critical thinking skills. We want them to be able to feel pain or compassion or happiness, joy, sadness. That all comes from the reality of living in this world. But then we want them to do something constructive with it. We want them to engage the gritty reality of the world that they are going to see when they are with patients. So why do we have small groups? Well, there's a couple different reasons. The School of Medicine here at Creighton University, our curriculum is grounded in active learning. And of course, because we are a Catholic Jesuit school, it's also grounded in Ignatian pedagogy. So it's very important for us to teach our students and to model with our students reflection, discussion, and character formation. This real transformation happens during their dialogue, during the discussion that they're going to be having in these small groups with you. When students grapple or struggle with really tough issues and hear different perspectives, that's when they are forming their character. And that's what we want to see happening in these small groups. It is difficult for them to really get to some of these tough issues if we are only speaking at them and they are not having a chance to discuss. And in small groups, they feel a lot more comfortable to be able to open their mouth, share their feelings, share their thoughts. And that's why we are using small groups for our ethics and humanities classes. We are so excited to welcome back our M4 co-facilitators. Almost all of our groups have an M4, a fourth year medical student who have already gone through the ethics and humanities classes with us. They feel comfortable with the curriculum, or they're also trying to get some more information about the curriculum. But we are so glad to have them back. They will be assisting you, the facilitator, with small group discussion. Sometimes they're on away rotations, or they are on a rotation where they're not able to come, and that's okay. We welcome them whenever they can be in class. They can also help you by leaving feedback on the student pre-class reflections in Blue Line, which we're going to be talking about in just a minute. So the facilitator and the M4 student will be working together to see who is going to be doing the comments, the completion on the pre-class reflections each week. So do stay in contact with each other. The two of you should be deciding who is going to be leaving comments this week and work it out with your schedule. The other thing we love about the M4 facilitators is that near peer feedback and mentorship is super significant for our underclassmen as they are forming their own character and identity. They want to hear from, they want to see what students are doing that may have been in their situation only 2 or 3 years ago. So let's look at the ethics and humanities schedule. M1s meet on Tuesdays from 3 to 5 p.m. M2s meet on Mondays from 3 to 5 p.m. And it doesn't matter if they're in Omaha or in Phoenix, we keep to this same schedule. All student pre-work and reflections are accessible through Blue Line. And once you've logged in the first time, just bookmark that site and you'll be able to get back to it easily every time. Please familiarize yourself with the pre-work before sessions. Leave feedback on reflections within 1 week of submission. So the student's pre-class reflection is not due until their class starts, which is the 3 o'clock time on the day of their class. So it would be difficult for you to get to all of their pre-class reflections before class starts. So you could do some of them. If some of them have already completed those, you could start by making comments or marking them complete. But you really want to give about a week after for you to be able to go back and make those comments. And as we're talking about the comments that you'll be leaving, it really should include something positive and something to work on or add to their thinking. Now let's take a look at the dashboard of the Blue Line. Blue Line is Creighton's version of Canvas. So if you have ever taught a course on Canvas before, many schools use a form of Canvas. Ours is called Blue Line, but behind the scenes, it really is a Canvas platform. This one here is for the M1 class, so our first year med students. It says class of 2027. So I know if I'm a facilitator that needs to check on any pre-work or check pre-class reflections, then I can go into the class of 2027 course and I will show you how you will check their pre-work. If I'm doing facilitating for the class of 2026, which are our M2s, our second year med students, then I would be clicking on this course here. And this is how they should be looking in your courses as well with these pictures. Now, the other thing I want to show you is over here to the right, you have some to-dos. Now, these are not all for me to grade, but you can see which reflections are ready to go. If you click on the grade August 24th reflection, it will take me to the gold track students for that course. And then I can find my students, they're in ABC order. Sometimes you will also have them be pulled up where you have your 10 students and you can just see them. Other times you may have to look for them in alphabetical order, but either way, it's fairly simple to do the grading by just clicking here to the right. And the others that do not pertain to you, those courses, you can just X out of them. Now, once you click on one of the courses here with the green arrow or blue arrow, you will see a board that looks like this. So you can see the modules, and the place where I go to the most are the modules that are here on the left-hand side. And when I click on home or modules, this is what I would see. This is also what the students can see. So you can see for Medical Humanities introduction that we had on August 15th, they had some pre-work to do. They have their pre-class reflection. And after the class, we do put the PowerPoint in a PDF form onto their modules so that they can get back to that presentation and get back to their notes. You also will be able to see the PowerPoint after that session. So let's go into the pre-work first. Let's see what that looks like, because you will also be coming to the pre-work area so that you can see what students are being asked to read or to watch or to be familiar with before they fill out their pre-class reflection. So here's a class called Medical Humanities, Who Am I Becoming? And this is their pre-work page. Sometimes it's very short, sometimes it's much longer, and they have a lot more pre-work than other times. This is a fairly short one. It's the beginning of the year for the M2s. And their pre-class readings, there's a paragraph there for them to read just to introduce them to the topic, but then their pre-class readings are just 2. So medical education and loss of empathy. After clicking on those and reading their pre-work, then they would come back to this screen, click on pre-class reflection that's in blue, and they would be able to fill out their reflection. Sometimes we ask them to keep their writing within a certain range, maybe 150 words to 250 words. Sometimes we want more from them, and sometimes we'll want them to keep it very concise. So just pay attention to that a little bit if there is any requirement on how much they should be writing. You don't have to be a real stickler on that, but you want them to be fairly close so that they are learning how to write in a concise way, something that physicians need to learn how to do as they are going to be taking notes. We will also send you a facilitator guide through email. The black portions are the discussion questions that we will use during your discussion time and during our presentation time for that class. And the parts in red are things that you could refer to that the students will not see. So you might be looking for certain responses. You might encourage them to ask more critical questions or to go down a certain path once they get started. And the facilitator guide can help you do that. You're welcome to print those out and bring those with you, but we will just be sending them to you via email. Now let's talk about some best practices before we finish up. These are adapted from 12 tips for promoting professionalism through reflective small group learning. And we don't have exactly 12 tips for you, but we are taking some of these tips from this material. One of the things that we've added, especially this year, is we are having a no laptop zone. We have told students this. The facilitators that have already been with us understand this. Students may use their phones for the Poll Everywhere. We will have some Poll Everywhere questions almost every class. And they can also check in on the with the QR code by using their phone. So they do not need their laptops. They do not need to be studying for another class. They don't need to be looking at any notes. They don't need to be taking notes. The class, the pre-work, their pre-class reflection, their discussion during the session, all of those things are going to be used for their notes. They will have questions for ethics and humanities on their quiz at the end of the week. So there is some accountability, but they don't need to be taking notes. They will be able to get back to all of their notes by going back to the blue line, and they'll be able to find the PowerPoint and all of the pieces that they had already gone through. Please encourage buy-in of the small groups and the discussion time by communicating the purpose and the importance of the groups. So you want to be talking positively about small groups. You want to be talking positively about the discussion time with students. It doesn't mean you're always talking about something positive or that everyone is agreeing, but you are talking about the groups themselves in a positive way and helping them to be compassionate with each other, even when there is disagreement, and talking to the students about the importance of the time that you're spending there together. Another great tip is using students' significant experiences or their own stories and their trauma or dilemmas or challenges as a starting point for discussion. And you can pull that out of them by asking for their own stories. And you will almost always have somebody that is willing to share a story from their own experience in their own life. You can always refer back to the pre-work. So the readings, the videos, the cases we're going to be looking at during your discussion time. Because you've read the material or perused the material, the students have read it or watched it, and you want to encourage students to refer back to those readings and videos and that pre-work material during the discussion time so that they're making a connection with the things that they've already done. Now, we do want you to be very aware of the hidden curriculum that happens in small groups through your role modeling. And this happens with M4s. They're looking up to the M4s. They want to be like the M4 that is in their small group. They eventually want to be like you as a facilitator. And the hidden curriculum is your body language or how you're talking to students. We'd like you to use appropriate techniques to challenge students and deepen the conversation. So you want to bring out that critical thinking. You want them to have a challenge, but you're there to support them as well. This can also happen as people around the table might be disagreeing with one another. There might be a challenge there. But we want you to go down that road of conversation, but with support. So asking them to think a little bit more about why do they disagree? Or what would they do differently? And much of this deep conversation is on your facilitator guides that you'll receive before each session. So use that, refer back to that, and you'll get some of that conversation on there that you would be able to share with students. Always be alert and learn from diversity, and we want to encourage that of students as well. Each one of your groups is diverse in gender, diverse in culture, diverse in race, diverse in knowledge, diverse in language, There's so many different things that your students have already done. There is so much to their background and their culture that we want to come out in their small groups. We want them to feel comfortable about talking about it. We want others to learn from diversity within your groups. It's also important to demonstrate relevance and application to future clinical practice whenever you can. Now, we know not all of you are clinical physicians, and that's okay. We are so glad to have you as facilitators, whether you are living in the clinical physician world or if you might be a faculty or a staff member that is not a practicing physician. We welcome all of you, but we want you wherever you can to make connections to the student's future. So it could be something where maybe they're already having a early hospital experience or early clinical experience, and they're able to talk through some of that. You might even have an experience as a patient, and that would be important to share. So it might not always be your own clinical practice, but you as a patient could also share information and make it relevant and applicable to the things that we're talking about. It would be important to embrace complexity and uncertainty. This one is very difficult for students. It may be difficult for you, but often there are not going to be right answers. You might leave a session encouraging students to keep reflecting, and maybe you want to pick it up the next time that your group is together, but we don't always have right answers, but we do have questions and we do have reflecting. And that's what we would like them to focus on, is not always being right, but learning how to bring up challenges or disagreeing or controversial topics in a compassionate way and in a kind way as they're talking to their peers. And our last tip that we have for you is really using these small groups to develop interpersonal and dialogical skills. We want students to use these small groups to help form their character and to work with each other. We want them to feel safe in the small groups. That's how you're going to get differing opinions and different challenges coming out, is when they feel safe. We call that psychological safety within our groups, where there's a high level of trust and there's a high level of expectation as well. Those interpersonal skills really build and get better and better the more they learn how to talk with each other. So that would be important as well. We want to thank you so much for your time, for your expertise. We need you, and we want you to have fun and enjoy your students and the small group discussions. So thank you for being a facilitator.